that sleep and gut health are so intimately related. Did you know that gut health affects your sleep? When our bacteria is in a good balance, that can promote sleep. First, we optimize gut health. That's always central. Eating great foods, eating the right foods. Hello, everybody, and welcome back to the Good Gut Feeling podcast, where we digest modern medicine with old world wisdom. Today, another topic that you can use right away to help your gut health and to help your sleep. We're going to be talking about the gut-sleep connection. How does sleep affect the gut, and how does gut health affect sleep? Before we jump right into it, just a quick couple of words. Today's episode and all our other episodes, they are for educational purposes and don't take the place of medical advice from your doctor. Let's jump right in. So many people are having issues with sleep, and many people don't realize that sleep and gut health are so intimately related. And a lot of my patients come to me for the first time, I sleep X amount of hours, or I don't get enough sleep, or I go to bed too late, but they speak about it as if it's not even related to their gut. First of all, sleep is a regenerating process. Sleep is not just passive. Like sometimes we think, okay, I'm gonna sleep, it's just rest. My body's resting. It's not just resting, because if you just laid in bed perfectly still for 8 hours or 10 hours or 12 hours and didn't sleep, you would be exhausted the next day. So we know that sleep is an active process, and during that process, the body regenerates. All our cells regenerate. All the inflammation in our body can heal. It's just about allowing the body to heal itself. So if someone has inflammation and they're doing all the right things, all the right foods and all the right supplements and all the right mindful practices. They're doing all the right mindful practices and they're not having results. Well, a lot of those results occur during sleep because the sleep process is regenerating. So if you are not sleeping enough and you're trying to heal, you may be stuck. And remember, if you are in a process, if you still have not reached your goal, the sleep needs to be at a higher level than just for maintenance. And we're going to talk about what does good sleep mean, but just to dive right in to sleep and gut health. Did you know that gut health affects your sleep? How does it do that? Well, number one, we know that the microbiome codes for everything in our body. These are the bugs that live inside and outside of our body and are a central piece in health. The majority of the bugs live inside our large intestine. So gut health equals microbiome health equals total body health. The bacteria, which is one of the kind of organisms that exist in the microbiome. So we have bacteria, we have viruses, we have fungi, and we even have some protozoa. So the bacteria actually synthesize neurotransmitters. Neurotransmitters are chemical messengers that communicate with the brain. In fact, the gut hosts the enteric nervous system, which is the brain nervous system, which is very intimately related to the nervous system in our brain, our central nervous system. Very intimate connection, but it even goes deeper. Serotonin is a neurotransmitter. It is a precursor for melatonin, which we know already is a big player in sleep. Did you know that about 80, 85, 90, sometimes 90% of serotonin is made in the gut? So if your gut bugs are healthy, they're making a whole lot of good serotonin. The serotonin is being converted to melatonin, and that's going to be really helpful for good sleep. And even beyond serotonin, when our gut is in a good balance, when our bacteria is in a good balance, that can promote sleep. If our bacteria is off, then we can have high stress, poor sleep, mental health issues. So all microbiome is intimately related to how we sleep, how we process stress, and not only do we fall asleep or do we stay asleep, but how good our sleep is. And remember, there's many factors that are very important in sleep. It's not just the absolute hours. But before we jump into that, what happens when we don't sleep well? How does that affect the gut? Well, it does. We don't get the right amount, the right quality, and the right timing of sleep. It can promote gut dysfunction, and it can actually slow down the healing process. Poor sleep can change the microbiome populations, and we know the microbiome populations can affect sleep. So now we have a vicious cycle of dysbiosis, or an imbalanced microbiome caused by bad sleep, causing more bad sleep in a vicious cycle. So we need to break that cycle. Also, if we are not sleeping well, we are in a high stress state, producing stress hormones like cortisol. Stress hormones like cortisol promote inflammation. That inflammation can affect digestion and harm the gut-brain barrier. And sleep is a vital part of motility. Motility is how the gut moves. We've talked about motility before. Motility is responsible for anything from esophageal function, preventing things like reflux and heartburn, for proper digestion of food in the stomach, for proper absorption of food in the small intestine, for proper reabsorption of water in the large intestine, so our stool is not too hard, not too soft, and just the right consistency. Motility is a very important part of digestion. It's peristalsis. So motility exists in every organ, but motility in the digestive tract is called peristalsis, the movement of the gut, which is very much related to its function. So what do? How do we break this cycle? First, we optimize gut health. That's always central. Eating great foods, eating the right foods. If you are in a place of high stress, high inflammation, high stress physically, high stress emotionally, that is the time to really clean up your diet. This is the time to eat mostly cooked foods, to eat light foods, not to eat late at night. Eating late at night is not great for sleep directly, because when you are digesting, your body can't focus on regenerating. So you really want to stop eating 3 hours before bedtime or earlier. There's so many benefits of not eating late at night. You get a time restricted eating pattern, but even more so, your body is ready to regenerate. It's not busy digesting. So eat early. Feed your microbiome. What do those bugs like to eat? They love plant-based fiber. So if your gut is off, you want to give the food to the good bugs, plant-based fiber. And ideally, if you're inflamed, it should be cooked. Because raw foods, even though they're highly nutritious, they can be difficult to digest for someone who has an inflamed gut. How do we prepare for sleep? Many people know we have a morning routine, but we should also have a nighttime routine. What does that include? So we want to start winding down. So 3 hours before sleep, we don't eat. Try not to do activities that stimulate the brain or stimulate the body. So a lot of people work out at night. It's not the best time to work out, because you want to work out and increase energy for the day. So that's really best for the morning. It's okay in the afternoon, but nighttime is not a good time for strenuous exercise. But you can go for a walk, a leisurely walk. That's really good. Ideally, no screens. Screens are stimulating, the content on the screens are stimulating, and the light is stimulating, because most of our artificial lights on screens are blue lights, and blue lights are not ideal, especially for sleep. But in general, so you can wear, if you need to be on your computer, blue blocker glasses can help. Ideally, no screens, 2 hours, 3 hours, whatever you can do before bedtime. So you can read a book, you can do breath work, you can meditate, you can take a walk, you can chat with your family. Don't speak about stressful topics. Try to speak about nice things. Then the half an hour before sleep is your real prep time. This is when you really put attention to what you want to manifest in your sleep. So in my sleep, I'm in parasympathetic mode. That is receptive mode. So the things that are in my brain as I am falling asleep are the things that are going to be processed in my subconscious while I'm sleeping. So what do you want to do? What do you want your day to look like? What do you want your month to look like? What do you want your life to look like? Take the last 30 minutes, if you can, even 10 minutes or 5 minutes or whatever you have, and use that. Use that for a mindful practice, whether it's gratitude for all the amazing things that happen in a day. Everyone has good things that happen in the day, no matter how bad your day is, because you woke up and you were breathing. So whatever it is that you can be grateful for, whatever it is that you want to manifest in your day, in your month, in your year, in your life, you visualize and you focus on that before you go to sleep, and let your subconscious do the work while you're sleeping. Most important things about sleep. Yes, absolute hours are very, very important. Some people need 7 hours. Some people who are not feeling well, who are dealing with a health issue, who are recovering from a health issue, some of them need more, maybe 8 hours, maybe 9 hours. If you're feeling great, everything's on track, 6 hours. Some people can do well in 5 hours. It's very relative to where you are in your health. So you can see for yourself, some people need more, some people need less. The quality of sleep is important as well. So some people can sleep 4 or 5 hours and feel great because their sleep is very efficient, because their nighttime routine is very effective. So when they go to sleep, those 4 or 5 hours, they're regenerating at a much faster rate than someone who needs 8 hours. So the quality of sleep is important. So if you have a great nighttime routine, you may actually need less sleep. And also, last but not least, something so overlooked is the timing of sleep. Many people think, okay, if I get my 8 hours, it doesn't matter if I go to sleep at 10, 12, or 2 a.m. It matters. Every hour is different. We are a different person every hour. We have something called meridians, which are energy channels throughout our body, and we have a number of them. And they have their own system. Some of them peak at certain hours of the day. Some of them have their activity decrease at certain hours of the day. So we are different in every hour. And ideally, when the liver and gallbladder peak at night, we should be long asleep, because those are the meridians that are very much involved in detoxification and regeneration. So if we are asleep earlier, we need less sleep, and the sleep is better. So if you're gonna get 6 hours of sleep, actually, if you go to bed at 10 and wake up at 4, that is a great sleep pattern. Or let's say you need 8 hours, you go to bed at 9 and you wake up at 5. It's a really great sleep pattern. The earlier sleep has more value. Our bodies are designed to work best when we are in harmony with the sun and the moon. So even though we can overcome that, and some people work at night and sleep during the day, but those people actually have shorter lifespans because it is a stress in the body. So the earlier we sleep, the better our sleep, and maybe even we might need less sleep. So if you are pressed for time and you're not sleeping enough, the sleep that you're getting, if you shift it to earlier, might be more effective, and you might even need less. Sleep and gut health are so intimately connected. So if you are trying to get your health on track, don't forget about sleep. If you like this content, please, we have so much more on wholegut.com. Please feel free. Sign up for our newsletter, sign up for our emails. Stay healthy, stay gutsy, and I look forward to seeing you all next week.